Hi, welcome to the CommQuest Hope Discovered podcast. Our subject today is the Mom and Me Recovery Program, and my name is Brooke Burkett. I am the Mom and Me Recovery Program coordinator, and with me today is Marissa Lindberg, our lead counselor and case manager for the Mom and Me Recovery Program. And today we just kind of wanted to meet with you guys and try to address some common questions that we get about our program. So that we can inform. So, Marissa, can you tell me what is the Mom and Me Recovery Program and what are some of the qualifying standards to get into that program?
Sure. So the Mom and Me Recovery Program was created to help mothers who are pregnant or who have young children under the age of 1 year old who are struggling currently or have any past use of any opiates or stimulants. So it helps with recovery supports while they are in treatment, to just give them some assistance with caring for their children or their child, so that they can focus on their recovery and on their treatment services while they're with us.
So they get a lot of benefits from the program, like a car seat, a pack and play, a stroller, diapers and wipes every week to help with those supplemental needs. We also help with things like hygiene kits, Desitin, all the things that mom might need to start off with her healthy pregnancy so that she can feel prepared for baby to come, even when, things may seem a little scary.
Mm-hmm. So, Brooke, what makes the Mom and Me program different from traditional treatment options for pregnant women and their families?
So I feel like the Mom and Me program really focuses on the baby and their mother. And we focus on recovery, yes, just like every other addiction program does. But what this does is it promotes a healthy pregnancy, one that we can get mom into recovery first before baby comes, or a healthy after postpartum birth. We want the best possible outcomes. We look at positive maternal fetal outcomes. And when we do that, we want to try to get people in recovery before that baby comes. But we also want to provide them with a lot of resources so that they can really focus on them and their baby and their recovery rather than having to focus so much on, I got to get a job and I have to buy all these things for my baby and I have to do all these things that I don't know what I'm going to do. It's so stressful. And that's a lot of time what, leads to relapse is all that stress surrounding all the things that need to be done.
Mm-hmm.
What do you think are the unique needs of our women who have these opiate and stimulant issues? What are their challenges, the risks that they face?
Yeah. So there's a lot of different things that come with a mother who is using substances while pregnant. Baby faces the potential for birth challenges such as low birth weight. There could be some respiratory or feeding difficulties upon birth. And even in utero, if somebody is using substances, specifically opiates and stimulants, there is concern that neonatal abstinence syndrome could be found upon baby's birth, which is essentially withdrawal that babies go through once they've been born, and can range from more mild to more severe, just depending on what the mom was using, and how much and how frequently they were using those substances. So we want to help with the Mom and Me program, try to get those, outcomes of these babies struggling with these difficulties down, which is one of the goals of the program, is to help moms while they're still pregnant get on medication or get into treatment so that they can stop using before baby's arrival and then decrease the chance of these birth challenges occurring.
So what about postpartum? What type of things would be a challenge postpartum?
So postpartum, the main challenge that we see is obviously if there's substance use while pregnant, that is detected after mom gives birth. Child Protective Services or the local social services will get involved a lot of times, to check in to see what's going on, if there's a bigger concern there. So if we help moms while they're already pregnant, getting treatment and getting some of these things in their lives together, before baby arrives, it can potentially eliminate the need for social services to be involved with them post-birth.
Awesome.
So how do we coordinate services such as mental health treatment, addiction treatment, OB treatment, and our social supports all into one big plan for these ladies?
So coordination is key, right? We can't do things just one piece at a time. If you do them just one piece at a time, you don't get the full circle. So when we look at coordination of services, we want to see, okay, what kind of addiction treatment do they need? What kind of mental health treatment do they need? Is there mental health struggles that they need to be on medication? Is there struggles that they need a group that would be of a support to them? One of the recent groups that we just started was we call it the EMT group, which is actually the early motherhood trauma group. So it's for women who have children that have trauma history, that they really need a group of supportive women to help with working through their trauma, working through their addiction issues, being able to focus on recovery and working through all of those negative things that would result in, struggling as a parent. So that's a big piece of it, is getting them the right services. We have OB care that we refer to. We have fantastic OBs in the Canton area that we list in our resource journal for all of our ladies of, hey, if you don't have an OB, let's get you connected with one. Here's a list of 10 that we could get you connected with. So that's one of the big things that we want to do as well. We have a pediatrician on site with us 8 hours a week. He has a text line, so our ladies get immediate opportunity to talk with a pediatrician about their concerns, to text a pediatrician to say, hey, I'm concerned about this. Should I take my baby to the doctor or not? And he responds pretty quickly. So that's an added service that is at social support need as well. And as well as we want to get these moms together on a regular basis. So we do a quarterly luncheon. And we get our moms together. They get a little bit of time of socializing and enjoying each other and just being able to chill as moms, because how many moms do you know that are like, oh, I'm stuck in the side with my baby all the time and I don't get to talk to anybody. So that's one of the big things that we want to do, is have them in this wraparound service that they totally need.
Yeah. And the coordination really helps there to be no things that are missed. That's the goal, is when we have multiple eyes on these ladies, we're all able to kind of put in our opinions, put in our feedback of, is there something that we're missing? Is there something that they need help with that maybe we haven't tried yet? So there's multiple eyes on their progress, ensuring that these ladies are being as successful as possible on this program.
Yeah, absolutely. So what would you say are some misconceptions that people have about moms struggling with addiction?
I mean, there's a lot of stigma in general surrounding addiction in the recovery community, but specifically with women who are pregnant and even have young children, there's a lot of thoughts that kind of float around of, oh, they're a bad mom. They're not a good parent because they struggle with addiction, or they cannot properly care for their children because they are struggling with addiction. Those are two ones that we see a lot. There's also, thoughts surrounding, oh, the substances, the alcohol, the drugs, whatever it is, are more important than their kids. And so that's taking priority, and they're not caring for their children like they should. Those are stigmas we see just, and like I said, in general with the addiction population, but specifically with some of our moms on the program. And that stigma can be really traumatizing to some of them. And it can prevent them from wanting to come get help, because they fear that judgment, and they fear that people are going to look at them the wrong way because of their situation, because they're pregnant and still struggling with use, because they have young children that they're caring for, but they're still using. And obviously the goal of addiction treatment in general, but as well as the Mom and Me program, is try to eliminate that stigma and increase their comfortability with coming into treatment services and feeling non-judged, and feeling like they can come in and that they can be honest and truthful and get the help that they need to be, the best mother they can be for their kids.
When I think about stigma as a whole, when we think about stigma when it comes to addiction, there is so much surrounding it that when we think about that, addiction is more important than your kid. Addiction is a disease. It's not, it's more important that I smoke crack than take care of my kid. It's not that simple. And I think that's where we have to get together with the community and people in the community to get them to understand, like, it's not always a choice. Like, this is not a choice, but it is a choice to get help.
Mm-hmm.
And we want the community to know that we're here so that referrals can be made and women can know, hey, I need the help. Come in. Great.
Mm-hmm.
Come to our walk-in assessment center. We are open 5 days a week. Anytime that you can be seen to start a service.
Mm-hmm. I think the sooner we really work on eliminating that stigma, we're really going to have more people that feel comfortable reaching out for help. It's gotten better, in recent years with more progress in the field of treatment and addiction and recovery. But the more that we can help destigmatize in our local communities is that the more people we're going to be able to reach and we're going to be able to serve.
Absolutely.
So what are some success stories that give us a reminder of why we do the work that we do?
Oh, there's so much success. There's more success than I could even name, but I think things that stick out to me is our numbers. We have a 56% reunification rate. So we get a lot of moms in the program, unfortunately, after the fact when they've already given birth and Child Protective Services has already got involved. Unfortunately. And the CPS is then sending them to us and saying, hey, get some treatment. So that's a lot of times they're getting involved after baby's born. But I think the assistance of the program really gets people to focus on staying in treatment and gets them to focus on getting to a better place in their lives. So that 56% reunification rate means 56% of our ladies who are involved in our program are able to reunify with their children within the first year, 2 years that they're in our program, which to me is awesome. Another success story that I can think of right now is one of our moms has been on the program for a while now. She's been in recovery for almost 5 years. And when she came to CommQuest, she was on probation, court involved, struggling. She got on our MAT program. She's had 2 successful pregnancies and births on our MAT program. She has successfully weaned off of our MAT program and is not on the medication anymore. She is a manager at her job. She contributes to society. She's able to be a productive human being and be a great mom. We love her kids. It's our favorite thing when we get to see her because they're so cute, just like all of other kids on our program. But that's one of our fun pieces of doing this is being able to see all those babies and get to see them doing positive things and moms doing positive things and all that growth that happens throughout this program.
Well, I think the relationships that are made with the ladies is really special too, because, even years later after they've had their children and they're off the program, they still remember us.
Yeah.
And that's always really cool to see them and to see that they're still doing well and they're still sober. They're still in recovery, even after their involvement with our services. So these services are really beneficial to a lot of ladies, and honestly, any success story is a good one. Okay. Anytime we get to see moms reunited with their children is going to be something that sticks in our minds for a long time.
Yeah, I constantly think of success is being able to maintain sobriety, and I think the program really helps women do that because there's a motivation to stay in treatment long term. A lot of our women, they'll come in, they'll do residential treatment at our residential facility. They'll go into our IOP programs. They'll go into our relapse prevention. And then eventually they get to a point where they're just doing monthly counseling. And the program really motivates them to stay in treatment for that 2-year time period after baby's born. And we have seen through many statistics that people who stay in treatment long term are able to maintain sobriety long term. So I think the program is such a motivation for that because it is the assistance of those recovery resources like the diapers and the wipes and all that stuff that motivates them to continue coming.
I think it's also, the fact that we're checking in on them.
Oh, yeah.
There's somebody there that cares and there's somebody there that has their best interests at heart, and we're looking out for them and making sure that they're receiving the supports and the services that they need. And for a lot of people who are, have struggled with addiction, this is sometimes the first time people have cared about their well-being and cared about them getting sober. So having the ability to be there for them and to support them in any way that they need can be a big motivator for them continuing to come to treatment too, if they feel heard and supported in that way.
Well, and there's also that reduction of the break in resources, a lot of our communities struggle with community resources, and a lot of people who come to treatment struggle with transportation. With our program and the ability to give out gas cards and bus passes and Uber cards to get them to and from treatment, that's also a huge help to them. And it motivates them to continue coming because they don't have that barrier in front of them. They're able to get to treatment. They're able to participate in treatment. CommQuest has expanded their services so much to do telehealth services. And how many moms do you know are like, oh, I got 3 kids at home. How am I going to get to my counseling session? I can't really get out and do all this stuff. Well, that's okay. We can do a phone session or we can do a video session. So you don't have to worry about getting a sitter. We can still do counseling and focus on you while your kids play in the next room, So a lot of this is reduction in barriers as well.
Absolutely.
Yeah. So what do you think were some changes when medical care was integrated into a recovery program? What blossomed there?
Yeah. So I think there was a really unique opportunity for these ladies, medical providers, to have some more education about addiction and about recovery so that they can be part of their support system as well. Because it can be, as we said earlier, these ladies sometimes do face unique challenges when they're pregnant and they were using or are still using substances. So having the medical care team involved is always going to be good in terms of continuing that support and that understanding of those unique challenges and helping eliminate some of those barriers or stigmas that they may be having on that end of, fear of going to the doctor for what their doctor's going to think that they used while pregnant. And it's just something that we can keep an eye on. They can do more frequent doctor's appointments. There's just more eyes on them and their care and their progress. Monitoring of medications if they're on any while pregnant to make sure that they're getting the appropriate medications, the appropriate dosages, and just continuing to monitor them any little bit extra that we can to help support them and make sure that they have healthy pregnancies. I think we've been really lucky to have such a good partnership with Altman in our community. And they are very familiar with working with our ladies as well as just women who are in recovery or in use as well, and really work with them on their birth plans to make sure that they have as positive of an experience when they give birth as possible.
Mm-hmm. I think we as a team have worked really hard to reduce the stigma in the medical field as well. One of the things that we focused a lot on was providing trainings to OB staff, provide those trainings so that they understand addiction, so they understand how to treat the clients, signs and symptoms to look for to make referrals. And that's one of the things that I think our ladies get fear of is like, how many ladies do we have come in that are in their last trimester finally going to OB care because of the fear that was surrounding, oh, I'm going to walk in, I'm going to do a drug screen for my OB provider and it's going to be positive and that will change everything. They will think so differently of me. So us providing those trainings, us providing the resources, and also being able to refer these ladies to OBs that we know, understand, and have had the trainings, huge difference, makes a huge difference in their mind and in the minds of the people that they're going to be working with.
Absolutely. So, after talking about all this, how can the community support these ladies? How can they support pregnant women, women with young children who are in recovery to help continue to destigmatize addiction?
I think education is a huge aspect of things. Not a lot of people are educated on addiction. People have a lot of negative mindsets about it. So the more we can educate the community, the better. And also, um, we have to put off a mindset of these are human beings. They're not just people who have an addiction. They're human beings who hurt and love and feel, and having the community resources to help them be successful is what's most important. So we work really hard to try to connect to community resources like Thrive, Help Me Grow, the Pregnancy and Parenting Center, the Diaper Bank. Like all of those community resources are such a help to our women, and it helps them continue to be successful. So the more that we can connect with the community, I think the less stigma there will be.
Absolutely. I agree. I think a lot of it does come down to education. And ensuring that people, are open even to listening, listening to what addiction is and how it's a disease and how people, come to that type of lifestyle. So I think the more we can educate and have people willing to listen and willing to be open-minded and to learn, I think we'll continue to, break down that barrier that a lot of people face when it comes to getting help.
Absolutely. So this was the Hope Discovered podcast for CommQuest Services. We hope you were able to learn a lot about the Mom and Me recovery program. And if you have questions, feel free to give us a call at 330-453-8252. You can also visit our website at commquest.org/moms. And if you're looking to get into services, please walk in for a walk-in assessment at our assessment center, open Monday through Friday.